Ladies and gentlemen, the Surgeon General of the United States, Dr. Regina Benjamin.
Good morning. You know, you can't believe all the stuff Pam just said. You know, she just can't. Most of it's true, but I'm not sure who she was talking about. But I am really honored to be here with you today and to see so many individuals who are committed to health and wellness. You know, I was really pleased to learn of IHRSA's initiatives which help promote healthy, active lifestyles, like the Get Active America, the 120 million by 2010, and I lost it at the club. Those programs really fit into what my priorities are about. I'm a real believer of the power of associations, because together we can do so much more than we can do alone. You know, a snowflake is one of the most delicate things in nature and most fragile, but look what they can do when they come together and they stick together. They can become an avalanche, and so can you and IHRSA. I thought I'd share with you a little bit about how I got involved in community and why I stay involved. When I was an intern, I attended the Medical Association of Georgia's annual meeting, and one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in medical school. Well, I stood up in a room with maybe 20 people, 25 people, and I told them I'd never seen certain diseases except in a textbook. And so I thought there was a need. The reference committee passed the resolution, and the Georgia delegation forwarded that resolution to the AMA. And they sent me to the AMA to speak to this same issue. The resolution passed. And within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference, whether it's in medical policy or in medical practice. And I learned that I could make a difference in medical practice when a National Health Service course sent me to Biola Battery. It's a pretty place, but it's a poor place. I found a community of working poor, too poor to afford medical care, but too rich to qualify for Medicaid. I liked the people, I liked the community, and I wanted to practice medicine there. But I quickly learned that practicing medicine wasn't just sewing up the shark bites. I had to deal with the land sharks, the regulators, the reviewers, the red tape dispensers, and all that paperwork that goes along with it. And so I decided to stay involved in every organization I could to bring programs and services to our community. The medical societies, the United Way, the Red Cross, Chamber of Commerce, the Girl Scouts. But I also learned that my patients had problems that are issues that my prescription pad by itself couldn't solve, like adequate housing, and especially after Katrina, employment opportunities, clean water. Let me tell you about a couple. One patient is, actually I'll stick to just one, because I'll talk about patients all day, but this one patient, Mrs. Smith, I ask my patients to call me when they have, concerns, and she called me on a Saturday, and she said, Dr. Benjamin, my back is really, really hurting. I went to see that specialist you told me, and he told me I have this slip disc, and he told me to lose some weight, and I'm trying, I really am trying, but my back is really hurting. Can you call me in something stronger? And I said, sure. I could hear the pain in her voice. I said, sure, I can call you in something stronger. But you need to come and see me on Monday and Tuesday. She said, I will. So sure enough, on Tuesday, I walk in the exam room, and she's leaning over the exam table in so much pain that she can't sit down. And I say, Ms. Smith, did the medicine I got you, did it help at all? Or that I called in for you, did it help at all? And she said, well, Dr. Benjamin, I didn't get it. What do you mean you didn't get it? She says, I couldn't afford it. I said, But you work at the school system. You have insurance. It's covered. Why didn't you get it? She says, well, I didn't have the copay. But I get paid on Friday, and I promise you I'll get it. And so I stepped out of the room, and I had my nurse go across the street to Jim and get her medicines, and we brought it back. And I went in the exam room, and I gave her her medicine, and said, you know, you really are hurting. Can you start taking your medicine? We got it for you. And at that point, her eyes teared up and swelled up with tears. And she says, oh, Dr. Benjamin, I'm so embarrassed. I didn't want you to have to do that. And I realized at that moment, I had taken her dignity from her. And I also realized that cultural competence didn't have anything to do with the color of your skin, because her skin was the same as mine. It has to do with allowing people to keep their dignity. And I tried to figure out how to make her okay with that and to make it right. So I told her about the fact that, since Katrina, people will donate money for small pots of money for times just like this. And if she wanted to pay it back on Friday when she got paid, she could, but she didn't have to. So then she was okay with that. And as I was walking out of the room, she says, oh, by the way. I said, yes. And she says, well, can I get a work excuse? And I said, sure, you can get a work excuse. Today's Tuesday. Do you want to go back on Thursday or Friday after you start taking your medicine? She says, oh, no. We have to strip those floors tonight. I've got to go back today. Here is a woman who can barely stand up because she's in so much pain, but she's willing to go back and strip the wax off the floors so our kids can live and go to school in a clean environment. It's people like her, and the reason that I was willing to move to Washington after 23 years of practice, to advocate for her, to be a voice for her. And I didn't start it off, but she is overweight, and she's about that high. And all of her problems with her slip disc and stuff could have been improved or possibly prevented had we had her moving, referring her to exercise programs and things that you're about. And so I'm really trying to be in Washington and around the country to advocate for people like her. But it was really hard to leave my practice in biobattery. But now I say I have 300 million Americans as my new patients. And so I'm especially grateful to be here during this historic time when we make changes in how we finance and how we deliver our health care. Changes that will eventually give all Americans access to affordable, quality health care. Prevention is the foundation of our nation's public health system, and prevention is the foundation of my work as Surgeon General. And as Surgeon General, my priorities really do focus on wellness and prevention. Last year, I was joined by Secretary Sebelius and First Lady Michelle Obama at a press conference to release my first paper, The Surgeon General's Vision for a Healthy and Fit Nation. There's perhaps no more serious a challenge to the nation's health and well-being than that posed by obesity and overweight. And you all know these numbers. Since 1980, obesity rates have doubled in adults and tripled in children. And the problem is even worse among Black, Hispanic, and Native American children. And we see these sobering impacts of these numbers in the high rates of chronic diseases, such as diabetes, heart disease, and other chronic illnesses like Mrs. Smith. But these diseases are now starting to affect our children more and more. A study from the University of North Carolina School of Medicine reported that obese children as young as age 3 show signs of an inflammatory response that has been linked to heart disease later in life. So I was really pleased to join the First Lady 2 weeks later for the launch of the Let's Move campaign to solve the problem of childhood obesity in one generation. Both my vision for a healthy and fit nation and the First Lady's Let's Move campaign takes a comprehensive approach that engages families and communities as well as the public and the private sectors. My vision for a healthy and fit nation is an attempt to change the national conversation from a negative one about obesity and overweight to a positive conversation about being healthy and being fit. We need to stop bombarding Americans about what they can't have, what they can't eat, what they can't do. We need to start talking about what they can do and what they can do to become healthy and be fit. But for people to do these things, Americans need to live and they need to work in environments that support their efforts. There is a growing consensus that we as a nation need to create communities and environments where the healthy choices are the easy choices and the affordable choices. I've actually been trying to set a little bit of an example with the Surgeon General's walks through various cities. We started out in Baltimore just after a conference and went outside around the harbor, walking around lunchtime with a group, and people started joining in with us. They would pay their lunch bill and start walking with us. Walked in Nashville with the mayor there. Los Angeles, we did a walk at the IDEA conference with 5,000 fitness trainers, and that was a lot of fun, and the mayor. In Boston with physicians, white coats and white sneakers. And my dear friend Pam Peake got me involved. I've always wanted to climb Kilimanjaro, but she said, well, why don't you do something here in the United States first? So last fall, we decided I'd never seen the Grand Canyon, so we would walk the Grand Canyon. And I got there, and she says, we're going to go rim to rim. It was 27 miles, 5,000 feet down and 5,000 feet up. But it was beautiful. It was great. It was great being outside. Although we had cameras in our faces, that was a little challenging. But it was still wonderful. And the whole idea is that if I can do it, anybody can do it. You know, it doesn't take a lot. It just takes one step at a time. And I really do believe exercise is medicine. And so I've become one of the spokespersons, and I've asked healthcare organizations across the country to join in the program initiative, Exercise is Medicine. And for those of you who don't know about it, it's a multinational, multi-organizational initiative that brings physical activities to the forefront of disease prevention and treatment by making exercise a part of every patient's interaction with their clinician. There really does need to be a connection between the clinicians, the fitness professionals, and the public, so that everyone can receive the guidance they need to stay healthy and fit. They really do need to have fun, have a good time. Kids need to play, jump rope, whatever, in the parks, but they have to do it because they're enjoying it. They can dance. We like Zumba. It's infectious. You do it because you're enjoying yourself, not because somebody told you go out and exercise for 30 minutes. Those of us my age, we didn't go to discos because somebody said exercise for 30 minutes. You went because you were having fun and thought you looked good and all those other things. We have to get movement back in our lives as part of our everyday lives. And, you know, if any way we can do that, we need to enjoy being healthy and being fit, no matter what size you are. We should remember that individuals are more likely to change their behavior if they have a meaningful reward, something that's more reaching and more certain than a weight or dress size. The reward has to be something that each person can feel, they can enjoy, they can celebrate. The real reward is optimal health that allows people to embrace each day, live their lives to the fullest without disease or disability or loss of productivity. I believe the fitness industry is poised to step up as a solution to the growing public health crisis of obesity and overweight. So I'm asking each of you to join me with the Surgeon General's vision for a healthy and fit nation. And I look forward to working with projects with all of you. And you know, I'm a family physician. I like new ideas. If you've got some ideas that we can get America moving, I'm open to them. I really want to take just a minute to be your doctor and say, take time for yourself. When I was on the plane coming here, the flight attendant said, put your own face mask on before attempting to help others, you've got to do that. And I think this is an audience probably who knows that better than most, because that's what you've been doing, is helping the rest of folks become healthy. But do take time for yourself and play and have fun and exercise yourselves. And also, this is flu season, so take your flu shot. That's important. And finally, I'm going to end with just a quick poem quick story that many of you may have heard, and that's a young girl who was jogging along the beach early one morning. And as she was jogging, she saw this older guy tossing these starfish in the water, one at a time. And as she did her run, he was still tossing these starfish one at a time. And when she finished her run, she just couldn't take it anymore. So she went up to him and she said to him, why are you bothering to toss those starfish in the water one at a time? There are hundreds and hundreds of starfish along the beach. As soon as the sun comes up, it's going to burn them all off. They're going to die anyway. It's not going to make a difference. Why do you bother? He looked at her, reached down, picked up a starfish and said, because it makes a difference to this starfish. And he tossed it in the water. I hope you will continue to make your differences and find those starfish and help us become a healthy and fit nation. Thank you very much and have a wonderful conference.